Health Spotlight, presented by Community Health Network.
In tonight's Health Spotlight, a new study reveals the pandemic led to racial disparities and access to treatment for one of the nation's leading causes of death, opioid use disorder. Wish TV's medical reporter Dr. Mary Gillis spoke with Wish TV's medical expert and former U.S. Surgeon General Dr. Jerome Adams about this research.
A new study published in JAMA shows the pandemic worsened racial and ethnic disparities in the use of medications to treat patients with opioid use disorder. So talk to me about this study. What medications are we talking about and what did they find?
Well, this was a study of patients who filled over 1.5 million prescriptions for medications to treat opioid use disorder. So many people need additional help to transition off of addictive drugs like heroin or like fentanyl. And the main two that people talk about are buprenorphine and naltrexone. These are two of the mainstays of what we call medication-assisted treatment. Now, what's important for people to understand is that the pandemic really disrupted care in all sorts of ways. We know that cancer screenings went down. We know that childhood vaccinations went down. This is answering the question as to whether or not people's access to medication-assisted treatment went down. And the study found that it did.
Barriers to treatment, environmental factors, financial costs, could these be underlying factors? And then again, are you surprised by this?
Well, I wasn't surprised by the findings of this study, but we should be concerned. And what do people need to know? They need to know that we actually were seeing prescriptions for medication-assisted treatment going up prior to the pandemic, meaning we were actually making progress in getting more people connected to care. Then COVID-19 hit. And we saw prescriptions level off on a national basis for everyone. But we saw that for Black and brown communities in particular, those prescriptions then went down precipitously during the pandemic. And it's why we need to look at information on a national scale, but we also need to break it down demographically. And that in part accounts for what we saw in 2020. And that was a 30% increase in opioid overdose deaths and a 30 to 40% increase in opioid overdose deaths for Black and brown communities.
What needs to be done? I mean, in the immediate term, can we do something? And then long term?
What we need to do is, number one, make sure we continue to collect the data and that we break it down by demographic groups, because not all groups are impacted in the same ways. Once we collect that data, then we can target interventions to specific communities. And this study shows us that we particularly need to go, again, to communities where you have higher rates of poverty and communities where you have higher rates of Black individuals from the data in this study, and direct interventions that will allow them to get better access to medication-assisted treatment so that we can prevent people from dying from opioid use disorder in continually rising record numbers.
Dr. Adams says the pandemic disrupted people's ability to get care while it ramped up stress, and it disproportionately impacted communities with lower incomes.